why are you not able to see your periods? First of all, I welcome you on our channel. Gerald Massa, the Health Educator, is the name of the channel. On this channel, we do talk about fertility, we talk about pregnancy tips, we do give you advice on how you can get pregnant faster, on how you can become fertile and get pregnant faster. And then also, we do give all pregnancy tips, anything related to women health. I welcome you, and if it's your first time on our channel, remember to subscribe so that you do not miss new videos we release every day. So without further ado, I'll first of all talk about a miscarriage. A miscarriage is a serious condition. When it happens, the first thing is the couple needs to go through a process of healing, both emotionally, psychologically, and then also physically. So if a miscarriage has happened, it's always good to realize that there could have been a problem. There could have been a cause of this miscarriage to happen. You do not need to put the guilt on either of the partner. You should not take up the guilt, because when you become guilty and then you begin putting it on yourself, if you did not induce it yourself, then it may actually put you in depression, and it may affect you psychologically, emotionally, and all areas. So allow yourself time to heal, allow yourself to go through all the healing process. Follow the advice of the experts, and remember, you can get pregnant again even if you've had a miscarriage today or you've had a miscarriage at any time. You can still get pregnant. The only thing you need to do is you need to get the advice of the experts and then follow that advice. Put in prayers. You can get pregnant faster. You need to put God first. So without further ado, we are going to answer the question that was asked by one of our viewers, and she said she had a miscarriage, but she has waited to see her periods. Her periods are not happening. Her periods are not seen. So we are saying that the first way we are going to answer this question is, first of all, to identify that if at all you've had a miscarriage, let's say you've had a miscarriage today, and then after 1 or 2 months or after 2 to 3 weeks, you are still spotting, you are still bleeding. This could mean that you could be having an issue with what we call RPOC. RPOC simply means you could be having retained products of conception. You could be having an issue with retained products of conception. Retained products of conception, we mean the pregnancy could have come out, but when there's still remaining pregnancy tissue in your womb. How can you tell that you have retained products of conception? Because you might have had a miscarriage 3 weeks back, but you are still bleeding. The only way to identify that you could be having retained products of conception, you are still having the blood coming out, the only way to identify is by doing what we call a pelvic ultrasound scan. A pelvic ultrasound scan, we've talked about it before. It is a test whereby images will be taken of your reproductive system. These are the ovaries, fallopian tubes, and then your womb. The pelvic ultrasound scan will show how your womb is. If there are retained products of conception, your inside, the endometrial stripe, will not actually be visible. Your doctor will not be able to see this inner lining known as the endometrial stripe. What will be seen on a pelvic ultrasound scan to confirm that you are having retained products of conception will be lots of contents. We call them echogenic contents. You will see that on your report. If you do your ultrasound scan and the report comes out and it shows that you have lots of contents inside with a volume of maybe 10 mils, 50 mils, or 100 mils. I've worked on clients who have volumes of 200 mils, lots of echogenic contents. They think that probably the pregnancy actually came out fully, but when they are still having lots of contents, lots of pregnancy tissue and mixed with blood. So when you have had a miscarriage today and then after 2 to 3 weeks or after 1 month you've had a miscarriage and you are still bleeding, please urgently go and do a pelvic ultrasound scan. Do it from a reputable place whereby you'll get real results. And once these contents have been identified that you are having these, then your doctor will suggest possible alternative, or your doctor will suggest possible medical treatments for you. Your doctor may decide to give you drugs to help expel these contents if at all the volume is low. Or your doctor could actually opt for your doctor will actually advise for removal through a special procedure known as a D&C. D&C simply means dilatation and curettage. It's a procedure which is done in theater whereby these contents will be removed manually, and normally it's a painful procedure, but you need to prepare yourself psychologically for this. And yes, your doctor will take you through all the counseling pre-operatively, that is before you go to theater. Your doctors and the nurses, the attending nurses, they will help educate you on what will be done in the theater, and then of course you are supposed to sign the consent form allowing that this procedure gets done. And after this procedure has been done by your doctors, remember this is a procedure which is advisable. You should not refuse to do the procedure, because what happens is that if you are having these contents in your womb and then they are not removed, you are most likely going to go into what we call sepsis. Sepsis is when these contents, remember, they are mixed with blood, they may actually begin rotting. And then when they do rot, what the end results are going to be, this infection is going to filter into your bloodstream because your uterus is supplied with blood vessels. So these rotting substances or these clots can easily go into your bloodstream, and then they may actually travel to your heart, and what may result may not be good. You may go into actually shock. You may go into what we call septic shock, whereby you actually, the results will not be good. So remember to have these contents removed either through tablets. If at all the volume is very low, there are drugs which can be given. This video is for education purposes only. We shall not mention all those different types of drugs. But there are special drugs which can be given. They can force your womb to expel these contents manually. Normally, you will experience pain. Remember, the pain is as a result of the contractions happening, and specifically, it may actually be similar to the contractions you get when you are giving birth. But remember to be strong, have this removed, and then give yourself a waiting time of at least 3 months. After these 3 months, you can still get pregnant again. But I always advise my clients to use these 3 months as a time of healing, as a time of identifying what was the cause of the miscarriage in the first place. So we've talked about the miscarriage, we've talked about what could be the causes of bleeding after the miscarriage. We are going to answer the question that was asked by one of our viewers, and she said that she has not been able to see her periods after 2 months of having the miscarriage. She had the miscarriage and then 2 months passed, but she is not able to see her periods again. So we are answering this question. Remember, you are on Gerald Massa, the healtheducator.com, the best fertility pregnancy channel. So ask me all your questions in the comments. I really love to answer all your questions. Ask me anything about pregnancy, about fertility, about how you can get pregnant faster, and I will answer. I will give you my best advice on how you can get pregnant faster. So we are saying that when you are not able to see your periods after 2 months of having had a miscarriage, then the cause could be that there's an imbalance in your hormones. But before we answer this question, we need to identify, or we need to understand that normally when a miscarriage has happened, there's always a cause. When a miscarriage happens, there's always a cause. To see